getting the car disinfected at the hospital. Hey guys, it's me again. So I wanted to do a video today about my experience going to the hospital. I did not go to the hospital like America Hospital where I was going because I was dying or something, or have coronavirus. I don't. I have been in Korea for a few months, and some of you may know, most of you probably don't. I suffer from several autoimmune diseases, and I have been out of my medication. So I needed to bite the bullet and finally go see a doctor. Now, I went to the university hospital because they have foreign-speaking doctors there, so I had an opportunity to see a doctor who spoke English. But I wanted to do the video today, not just to explain the differences, but I wanted to show you a video I took of the coronavirus drive-through, and also this spray down they did of our car as we were leaving the hospital grounds. So that was really interesting. It was kind of cool and scary at the same time. But anyway, so I go to the hospital, and they are incredibly efficient. But because I don't have insurance in Korea yet, and the reason I don't is because my marriage visa has not come through yet because of the coronavirus. I have not been able to complete my filing, so I had to pay cash, which is why I didn't want to go, because being an American, I know how much healthcare costs every time I have to see doctors in America. And it wouldn't just be one doctor, it'd be my primary care, and then a rheumatologist, and then a hematologist, and then an oncologist, and blah, 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 blah. And so the cost of all the lab work and doctor's visits would just be so expensive that many times I would just avoid getting things done. But anyway, my husband, the sweet man that he is, insisted that I go. So I went and saw the doctor, and you go to all these kiosks and you pay, and then you go see the doctor, and then you pay, and then you get your lab work done, and then you pay and you get your medication. But I want to break down the cost, and then I'm going to show you the videos that I took. So the cost that I paid in Korea without insurance, no insurance, to see the doctor today at the university hospital, now this is primary care doctor, cost me $21.66 without insurance. Now, I had to have 4 labs done. I'm not 100% sure what the labs were because we were moving so fast and everywhere that I couldn't quite read everything that was on it. But the general idea that I got, that I think is what it was doing, was getting a CBC, a complete metabolic panel, and a urinalysis, which is, these are all standard things. And then because of my autoimmune disease, I believe one of them was another ANA titer. Now I'm telling you this because I also did an American breakdown. So my lab work came to about $139 US. And then I had 4 medications I had to pick up. And so the cost for all 4 out of pocket was $86. So the total that I paid was $247.11 for the entire day. Doctor, lab, medicine. And I'm going to show you that breakdown too. So now let's talk about the costs in America. I'm still paying medical costs for America, and I don't even live in America anymore. Anyway, so the breakdown I did for the cost is in America is out of pocket. I researched, and there is a varying difference in how much things cost for in America. So what I did is I found that the average, the ranges, and then I averaged them out. So to see a primary care doctor in the U.S., again, this is on average, without insurance. And of course, you can go to places like Zoom Care and things like that where they do based on your income and you can get them cheaper. But the average to see a primary care doctor out of pocket would be about $225. And I worked in healthcare for 15 years, and I can tell you that this is about true. Now, the similar testing, average for lab work, the ANA titer, the comprehensive metabolic panel, the CBC, the urinalysis, on average, the 4 of those out of pocket, give or take where you live, etc., would be about $485. Now, the medications, I've also done the averages, would be about $467. So the total out-of-pocket expense in America for the exact same care that I just received today in South Korea would be $1,175. I paid $247. This is not lower level of care in Korea. I had fantastic care. I didn't have to wait 3 hours. I didn't even have to have a doctor's appointment. There was no doctor's appointment needed at all. I got seen right away. Everything was done with incredible efficiency. The doctor listened to everything I said. He was not just like a wham, get in, get out thing. He really took whatever time I needed. He researched things he needed to, because I do have, and one of the autoimmune I have is very, very rare in the United States and even anywhere in the world, especially here in Korea. So he took the time he needed to do that, to make sure, and we communicated well. I got fantastic care for a fraction of the cost without insurance. Now, I also checked what it would cost me in America for the similar things if I still had my insurance in America. And with my doctor's copay, my copays for my medications, and then knowing that my insurance only paid about 80% for labs, I still would pay about $240 out of pocket. Now that might be a little more or a little less. So with insurance in the United States, I would have paid the same as I did today without insurance in Korea. So something is very wrong with the healthcare system in the United States. And we know that already. That's not like, I didn't just give you like some kind of huge news flash. But why is it working here and it's not working in America? Now, I'm from Oregon originally, so all of the stats I gave were actually nationwide based, except for the medication ones. I actually did the research based on the average of the pharmacies that I shopped at in my hometown, and those were Walgreens, Walmart, Rite Aid, those types of places, and the averages of those medications. So I'm just floored that a foreigner who comes to this country without insurance can get what she needs without it being I didn't get denied for medication. One of the medications that I received today actually is something that my insurance in America didn't want to pay for the longest time. I didn't even ask for it. My doctor said, you need this medication for your diagnosis. Why are you not on it? Well, let me tell you why. Because in America, I couldn't get it. And so I just wanted to share this video with you guys. I hope you like the video I took of the coronavirus drive-through. I tried to do it secretly a little bit because, again, these people have worked really hard. They were very tired, but I did think it was very cool that I didn't see huge long lines of people trying to go through the drive-through, which I think is another testament to the fact that what we're doing in Korea for the coronavirus is working, because there just wasn't a lot of people that needed to be tested. When I did walk into the hospital, though, they did have like this chained off line of nurses and doctors that are forcing you through this, not just a triage area, but, you know, screenings for the coronavirus before we could even get into the hospital, which was fantastic. And I could also immediately see what my temperature was, which made me nervous because one of my autoimmune diseases does cause fever. And I was like, oh my God, they're going to freak out. They're going to push me down to the ground like some kind of SWAT team thing like I've seen on... I was thinking like China takedown, because I've seen those YouTube videos, and I was like, oh no, please don't. I've had 3 back surgeries. I can't take a takedown on a hospital ground. But no, it wasn't like that. But anyway, and then of course leaving the hospital and getting like the shower of, I don't even know what, was like, oh, what's this? We're getting a free car wash. No, we're getting a virus car wash. I don't know. Anyway, leave me comments, you guys. Let me know what you think about the healthcare system where you're at. And let's have some open dialogue on what you think has been some of the challenges that you've had, and if you share some of those feelings. Anyway, I hope you're having a great day, and as always, stay classy, YouTube.